the thing that we're trying to do is we're trying to accelerate healing by activating stem cells, because without stem cells, our bodies literally can't function. When I got the MRI, and that was about 4 years ago, the radiologist, when he sat down with me to review the image, he said, "Hey, it looks like you've had surgery on both rotator cuffs." And I said, no, that's stem cells. And he's like, "You got to be kidding me," because you could actually see where the reparative work had been done. I'd had 6 concussions, pretty severe ADD. And so I went back to the clinic and we grabbed the sphenocath and we did the nasal mist. And, I went to bed that night and I slept 11 hours and I woke up the next day and my brain was quiet and it was magical. You could hear birds chirping. It was probably the most profound effects that I've ever had with the treatment. All right, hello everybody. And welcome to the Health Accelerator Challenge. And I will let people cruise on in here. Good to have everybody in. Good to see you all. And as we have new people who come in, feel free to ask questions. This is a format where you can essentially ask anything. You can and if it relates to the topic, that's even better. But if not, no problem. So a few more people. Good to see everybody. All right. Well, today we're gonna jump into some interesting things on regenerative medicine. So we've been talking about building this operating system for your body. So imagine that you have this personalized way of looking at your body and optimizing all the primary metrics that really move the needle. And that's what this course is about. And we are jumping into week 4. So if you haven't heard, if you haven't been here the last 3 weeks, then it would be it's a good chance to go back and review, because we've talked about mitochondrial health. The importance of getting your mitochondria out of that cell danger response. We touched a little bit on methylene blue, some of the mitochondrial peptides like MSC, 5-amino-1-MQ, humanin, SS31. Then we talked about muscle span. We talked about the peptide ACE31. And we also talked about getting rid of the white fat in your body. So that's where cold exposure is really important. So how many of you have got some cold exposure over the last week? Anyone jump in an ice bath or maybe took a cold shower? How many of you still want to throw up anytime I talk about it? And it's so funny. I spoke to one of you in New Jersey, and you were just saying, I just anytime I think about cold, I just get nauseated. I just don't like it. So that's okay. It's not for everybody, but it does help with what's called brown fat activation or beige fat activation. And then the peptide we talked about is adipotide. And then last week we talked about vascular inflammation and how the vascularity, how important it is in your body. Removing any kind of interferences in the endothelial cells. And, we tied it into kind of the nitric oxide with mitochondrial health, with the vascular inflammation, excuse me. And the blood is essentially without proper blood supply, your health dwindles very quickly. And so this is one of the things we're going to discuss today is one of my favorite topics, and that is stem cell vitality. So we're going to jump in, and I will share my screen with you guys, because I have Anne who can help me on the back end, who's been great at this. And here we go. Okay, stem cell vitality. All right, so what's a stem cell? And I think a lot of you on here, you've received stem cells, and and just had a phenomenal experience. Some of you are just brand new in getting your stem cells, and they're still, multiplying and hopefully regenerating that tissue that we treated. But one of the things that the body does is, as we age, our bodies have this loss of stem cell, not only population, but actually what we've learned over time is that our stem cells actually don't replicate as quickly. And so if you look at somebody who is like a newborn baby, our stem cells, when we're newborns, they replicate and replenish themselves every 24 hours. So, I mean, you think about that, it's like you're going to be doubling the amount of stem cells every day. And so by the end of 30 days, you're going to have about 1 billion cells. Whereas you take somebody who's 65, and our stem cells replicate about every 60 to 72 hours based on your health. And so by the end of the, like 30 days, you may have just somewhere around 50, 60,000 cells. So the thing that we're trying to do is we're trying to accelerate healing by activating stem cells, because without stem cells, our bodies literally can't function. And there's a great book that I'd recommend you guys read called Biology of Belief, and it's by Bruce Lipton, written about 25 years ago. I remember reading that when I was in Hawaii at school, and I was like, oh, this is so magical. But he talked about stem cells take on the expression of the environment that they're in. And so what we're going to do today is we're just going to create this nice healing environment for your stem cells. So if you just pause for a minute, you take a deep breath, and you just think about all of the energy in your body and all the life-giving blood and all these beautiful biological functions. You think about your 37, I think, trillion cells in your body, and just all the cool ways that they operate and they function. And then you think of these stem cells, and these stem cells are these life-giving cells that don't yet have an expression, because you have about 220 different types of cells. And as long as you have good, healthy stem cells to replace the cells that have been damaged, then your body can get ahead of the aging process, because that's one of the goals. Is we want these compounding catalysts that allow you to get healthier every year, whereas most people are aging every year. And so stem cells have been vital for me, because they've helped regenerate, rotator cuffs, and that's how I learned about stem cells in the first place. As I was in a snowboarding accident, I had a choice to hit a tree or hit a skier, and I love trees, and so I took out the skier, and sure enough, I was after cartwheeling for about 100 feet, I knew I did something very damaging, and I went and got an image the next day, and sure enough, the MRI showed a full thickness tear in my rotator cuff. And after 6 months of pain and failures, I finally went and talked to a surgeon about the treatment options, and the surgical success rate was like 57%. So I was like, that's not good enough. I've got to do something different. And so that's where I looked into stem cells. I worked with doctors out of Texas, and I got stem cells from the umbilical cord, and ended up injecting my shoulder. One of my physician assistants at the time, and within 3 days, I started noticing a difference. And then by the 3-month mark, I was doing pull-ups, push-ups. And it was as if the accident never happened. And so I wanted to test the hypothesis. I tore my other rotator cuff skateboarding. Stem cells healed that one up. And then I had a double rotator cuff tear. And when I got the MRI, and that was about 4 years ago, the radiologist, when he sat down with me to review the image, he said, "Hey, it looks like you've had surgery on both rotator cuffs." And I said, no, that's stem cells. And he's like, you got to be kidding me, because you could actually see where the reparative work had been done. So these little cells are powerful. But as we age, you think of a 3-year-old, how pliable they are. They can fall down a flight of stairs, and they're like, Gumby. They get up and, they're back on the move. But when we're 80 and we fall downstairs, it may be the last step we ever take. And that's because our stem cell population decreases. So as you're breathing and as you're thinking of bringing life into your body, just by you changing the cellular expression and having an environment where your body is open, it's receptive, you've got inflammation down, you've got blood sugar balance, you're going to have a better stem cell population and stem cell replication. So keep breathing as we're talking here. And I am flying solo, and so if I miss a question, you can raise your hand, and I think I can snag these in the chat box. But so there's different sources of where you can get stem cells. You can actually pull them from your fat tissue. The reason I didn't want to do that is because I'd been exposed to a lot of glyphosate, a lot of chemicals. Growing up on a farm, that's one of the reasons why East West Health exists, and that I got into alternative medicine or more longevity medicine. But your stem cells have been exposed to everything you have. So that's where the Nobel Prize winner, Dr. Yamanaka, and it's called the Yamanaka clocks. What he learned is that he can take a stem cell, he can take like a skin graft from an adult, and he can induce it back to its original state. And so when he reverses all of the epigenetic damage of the cell, and then with using Yamanaka's clock, and then you can induce that cell to take on a specific lineage. And if you'd like to learn more about that, Tim Nelson was on the podcast. He's got the company We Build Hearts. I work with him and Dr. Gustavo, he's in Argentina. But Tim Nelson, his team, when you take these cardiac cells that they take from infants who have heart defects, what he'll do is he will regrow that heart tissue, and you'll see it in a petri dish when after 3 or 4 days of cultivating these stem cells from the infant and inducing them into cardiac cells, they'll all start to beat together in harmony and just is gorgeous. And so what he has FDA approval to do now is to repair any kind of cardiac damage or any issues that babies have in the womb. He can actually repair that when they come out, and these cardiac defects are corrected with stem cells. Phenomenal. And he also can now treat congestive heart failure. So if you have ischemic tissue, the problem when you have a heart attack is you lose oxygen to certain parts of the heart, and then those muscles and those proteins start breaking down, and they become very toxic, and then you lose the muscle, and you rarely do you regain your energy. But with stem cells, you can actually regain it. And we've actually seen that even with what we're doing here. But the reason we don't use stem cells from your own body is because they have the same epigenetic kind of clouding and masking that you have. And so that's where we have found that using these stem cells in what's called the perivascular region in the umbilical cord, that's where we can get some of the very healthy, robust stem cells. And now that we've seen with some of the new breakthroughs, we used to be excited 10, 12 years ago to have 1 million live MSCs post-thaw. Now we're seeing upwards of 40 to 50 million per ml. So we can get very healthy stem cells. They cannot be manipulated. That we keep them in their natural state. And then in every vial of stem cells that you have, we're having you put your intention into those stem cells as you're thawing it out, as you're activating that material in those cells. You want your intelligence to connect with the intelligence of these cells so that they go and they can help your body repair areas that need rejuvenating and regeneration. And I think it's one of the most phenomenal treatments, something I've been incredibly blessed by, because it's, I've got kind of a little bit of adrenaline junkie in me. I like sports that are gravity fed. And so stem cells have been phenomenal in repairing injuries, the multiple injuries that I've had. Here's what we see with knees. Knees are probably the most common thing that we treat. And we've seen really cool things when it comes to helping your body's own stem cells start regrowing some of that tissue matrix. Um, One of the things that we saw, I was at Da Vinci 50 a couple of weeks ago, and Dan Sullivan, who's he's been on the podcast. I've talked about him many times. One of my mentors and strategic coach, but he had a meniscus that was removed from a knee injury, I believe, in his 20s. He's pretty young, and he wanted to regrow the cartilage and regrow the meniscus. And so he's been going to Argentina, and actually we're seeing now where he's got some meniscal repair. But right now in the United States, we can't do stem cells like that. But what we're seeing just by using these umbilical cords, we're seeing 1 to 2 millimeters of cartilage regeneration, which means you can walk without pain, you can go up and down stairs, and we see this all the time. And so I want to stop and make sure no questions are coming in there. Looks like we're good. And then the other thing we see is with shoulders. This is a patient of ours who just wanted to be able to fly fish. You can see lots of damage and arthritis on his shoulder, and we treated him, and we got an image about 6, almost 7 months later, and you can see still has some arthritis, but much better shape than what the shoulder started with. And so even if you have damage to the bursa, maybe you've got arthritis, just by putting the same material that allowed us to grow into humans, the same that same raw material is what we're using in these vials, and it's phenomenal how well it looks. And when I first got treated, some of the questions I asked, like, well, what are the downsides and what are the risks? And that's where we see with some of these induced stem cells, like Dr. Nelson's doing, that Dr. Gustavo's doing, some of these induced stem cells, or even these embryonic stem cells, they can take on a life of their own, and they can actually start replicating without stopping. And that's where you see some real dangerous things happen. And there's reports of, cancerous tumors, teratomas. But with the perinatal stem cells, what we've seen is because it's this native tissue, and there's not human leukocyte antigens, so that those are the antigens, these protein structures that would flag your immune system to see a foreign agent. Because it doesn't exist, the womb is an immune privileged environment. You don't see the immune rejection like you would if someone was to donate a kidney to you, or have a heart transplant where you'd have to be on immunosuppressive drugs. The other thing is because these cells are signaling cells, and MSCs are mesenchymal stem cells originally, but Arnold Kaplan, he decided, these are more like signaling cells. So they're changing the signaling process in your entire body. And the signaling is where it's at. If you can have great communication in your cells, then your cells can regenerate. So these stem cells, they're signaling and looking for areas of your body where there's inflammation and damage, and they're going into those areas, and they're repairing the damage. And I'll show you some of the evidence on that. But we've also seen that they turn off those inflammatory pathways, like tumor necrosis factor alpha, IL-6, and because they turn those off, that stops some of the recruitment with cancer. So we found this to be incredibly safe, well tolerated, so much so that now in Utah, May 1st, we had the Senate Bill 198, which I've spoken about many times, but that allows the use of perinatal tissue, perinatal stem cell therapy to be used in Utah. As long as we follow, the tissue reference guidelines and FDA-approved facilities, no manipulation of the tissue. We can't make claims because it's not FDA approved, but it does protect us in using those in the state of Utah. We're the first state that I know of to adopt that law, which is really exciting. This is a client who had a hip issue, and that hip issue, you can see that she had some very severe arthritis, and the doctor told her, there's nothing we can do. You're too old. She was 85, and she actually lived in South America and Argentina. And her family lived here. She came in, and we said, "Oh, let's see if we can help." And she didn't really pass any of the health. So don't let your joints get too far gone. That's one thing we have learned too, is the medicine we have today is great, but it gets better and better every year. So if you can just hold on and keep as much health in your joints as possible, you'll be really grateful you did that in the future. Because one thing, in talking to Dr. Gustavo, Dr. Nelson, is we all agree, and in our case, we've done over 25,000 of these procedures. And one thing that we realize is if the health of the patient isn't fully engaged, then the quality of the outcome of the stem cells is going to be minimized. And so even if you induce it, I mean, and that's where you've got to have a great lifestyle. And so making sure you're getting your blood labs ran. We found that when we first started doing these therapies, it was like half the people did really well and were really excited, but then the other half didn't. And at the time, it was such a big investment. I mean, it's the costs have come down substantially these days, but it was such a big investment. I said, man, there's got to be a better way. And so I started researching, and that's where I learned about things that we eat that turn off the signaling properties of the stem cells. And specifically, there are stem cells in your small intestine called the CD34 cells. And they're recruitment cells for all the stem cells in your body. And so your small intestine is very connected to the regenerative properties and rejuvenating properties in your body. And I learned that gluten is one of those. For some people, dairy. We also learned corn, especially like the GMO corn, was a big deal. And then alcohol and sugar. And so we got, and that's where many of you have received our anti-inflammatory diet. But if you go on an anti-inflammatory diet, you get better signaling. And we found that took our success rates from about a 50-50 to closer to like a 75-80% range. And then, using acupuncture, Chinese medicine, that helped. And then adding in PRP, ozone, that was great. And then when we brought in peptides, that got our success rates closer to about a 95%. There's still 5% of people who just don't respond with the first treatment. Sometimes it just requires another treatment, and then we see the breakthrough. And it's very rare that we don't see at least a 50% improvement. And in many cases, people end up out of pain. I mean, I just spoke to a client today who was here 2 weeks ago. And then he went back home to New Jersey, and he said his pain was gone the next day, and it hasn't come back yet. And that was pretty exciting because he's had his issue for quite some time. So, and actually, I think I did see a question that came through. Let me answer this real quick. Dow, good to have you on. Do stem cells have to be injected into the injured joint, or will the sub-Q go to the injured joint and heal it? Well, and this next slide actually answers that question quite a bit. But generally speaking, it depends on how severe the damage is to that joint. But we've had patients who they said, man, ever since I did that, like all my joints feel better, my fingers, my toes. But in most cases, you're going to want to inject right into that area that's been damaged so that you get the quantities of stem cells needed in order to get the result. And so, but here's a study where they tagged these stem cells. And the hypothesis was, well, this patient has right-handed arthritis, no arthritis in the left hand, and would stem cells preferentially migrate to the areas of the body where there's arthritis, or will it just go everywhere? And so they did the infusion, and then they tagged it with these radioactive isotopes, so you could see it through an image, and you can see right after the infusion, the whole body is, there's stem cells everywhere, a little higher concentration in the right hand, and then 90 days later, you can see the same patient, and you can see that there's really no stem cells in the left hand that were detected, but there's still activity of stem cells in the right hand. You can see activity in the thyroid and the pancreas and the liver. And so this patient also had some thyroid and liver issues. So hopefully that helps a little bit on your question, but really the best thing is to treat it directly, but you will get some benefits even if you do it subcutaneously, because subcutaneously will do the same thing as an IV, but phenomenal. One of the treatments that I had the opportunity to do, and I was the first person outside of a clinical trial that I know of. This was just about a decade ago, just over a decade. I was at a conference. I'm in the Perinatal Stem Cell Society, and been able to present to the group, but usually I'm there learning. But I learned about the best way to treat the brain was through intranasally, because to opening up the blood-brain barrier so the stem cells could actually pass through. We'd use a drug called mannitol to do that. It was just too risky. So once I learned about this technique, I was watching an image where the stem cells would migrate to parts of the brain that had been damaged from patients who'd had traumatic brain injuries. And I'd had 6 concussions, pretty severe ADD. And so I went back to the clinic, and we grabbed the sphenocath, and we did the nasal mist. And I went to bed that night, and I slept 11 hours, and I woke up the next day, and my brain was quiet, and it was magical. You could hear birds chirping. It was probably the most profound effects that I've ever had with the treatment. And then since then, we've seen hundreds of cases where people's brains are turned on again. So and it's very safe. Nasal spray. There's no injections. And the cribriform and your olfactory nerves, you'll see that from a cognitive perspective, our sense of smell is so connected to our brain, and it does make sense where you can see all the regenerative properties that can happen. And then the other thing that's really exciting, and I'm about ready to start round 2 of my plasma exchange. I did this at the beginning of the year, and I'm a little late. I just realized I'm going to do it every 6 months, but I'm like, I did this in 1st of February, so I'm a little behind, but and Amy's got it set out for me here, and she just texted me like, "Don't forget your cord plasma." But when I looked at some of the best ways of clearing out inflammation in the blood and creating an environment where you can get the best benefits, because what I've always been obsessed with is how can I help you get out of pain and get regenerated and have as much energy and as much vitality and as much vibrancy in the least amount of time possible with no downside, or as little downside as possible. And one of the treatments that's been big in the longevity space is what's called plasmapheresis, where you pull out your blood and then you replace it with the albumin, so it's basically a protein in liquid, and that's very effective. But it requires you to be hooked up to a dialysis machine, and so I started looking at well, what about the cord plasma? I mean, there's got to be some benefits there, and then I started looking at it, and I found this study, and what they found is that the cord plasma concentrate has some of the same benefits as if you're doing the plasma exchange. Not only does it help you age slower, so you actually gain by doing this, you gain about maybe a month and a half every year of lifespan and health span, but it also lowered some of the main biomarkers related to inflammation and aging. And so some of the things that we've seen, with the cord plasma and with stem cells is it can help all kinds of different conditions, can help regenerate those. We see it with anti-aging, autoimmunity, heart disease. You can even treat your face. And a lot of you have gorgeous faces. And I want you to protect those. And so that's where I did it once. It's been about 6, 7 years ago. I need to do it again. And we have a much better technique now than we did back then. It was a little painful back then. One of the reasons I got jumped back into it. But yeah, even for cosmetics, for hair, all kinds of things you can do. So, but once again, if you don't have the internal framework, if you don't have the health and the environment where your stem cells can thrive, you're not going to get the same impact. So one of the things we've discovered is, like I mentioned before, there can be some damage from alcohol in your system. And so we're just going to give you guys a challenge for the week to get rid of alcohol and see if you don't sleep a little better, have a little lower stress, have a little more mental clarity, and have a little better impact on your stem cells. And then, give yourself some appreciation and gratitude for this challenge. So hope you guys enjoyed that. We're your Ageless Future team. Really appreciate you guys being part of our community. And by the way, our website has, where we had to remove some things because we had a little hacker. It's a 20-year-old website. And so I guess what our web developers told us is that all these old kind of coding things caused phishing to occur. I don't understand all the terminology, but it will be fixed soon. If you're having a hard time navigating it, you can go to agelessfuture.com, and that's where you can jump in and it works. But we're here, and I appreciate you guys. So challenge for the week: get rid of the booze, and you'll have let's see if you have some insights for us next week. So appreciate you guys, and as always, any questions, anything you want answered, I try to be here almost every Wednesday, and I believe I'm in town unless I'm out of town, and I think I'm here next Wednesday too. So appreciate you guys. Bye-bye.